My name is Philipp. I'm an infectious disease physician from Switzerland, and I would like to present to you our healthcare worker cohort with the name Surprise Study. So we started this cohort back in 2020. It consists of healthcare workers from 11 different institutions. You can see on the map the geographical coverage. It's really in the north and in the east of Switzerland. And we include healthcare workers with and without patient contact. And the aim of the study is really to study COVID-19 and also aspects of long COVID. This was mainly the goal in the beginning of the study. Here you can see our homepage. We have a homepage with study information on it, and participants can read the information and give their electronic consent. We have almost 4,000 participants. They are mostly female. Median age is 40 years, and 40% of them are nurses. We sent people a link, a personalized link, per email or SMS, and we asked them about exposures, symptoms, vaccinations, and also SARS-CoV-2 test results. We also did serologies. We did blood spots, dried blood spots, but also venous blood draws to see if people got asymptomatically infected over time. We were quite productive the last 2 years. We published different studies on the immunity conferred by previous infection, on long COVID, and also on the risk of masks or the protective effect of masks. You can see this in this slide. So here we looked at the patient exposure. So how much patient exposure do participants have? This is on the x-axis, and on SARS-CoV-2 positivity on the y-axis. You can see that with increasing patient exposure, people are more likely to get infected. And what you can see in light blue, people using respirators were less likely to get infected over time. So this suggests a protective effect of respirator masks. How do we communicate? We send emails of serology results to participants. And as I showed you before, we have the homepage, and we also send newsletters to participants with study results and publications. We had quite a high response rate in the beginning of the pandemic. We did this publication together with Onicio, who is also in the room, a response rate of 64%. And this unfortunately dropped over time. There are many reasons for this. One of them is that the COVID momentum is gone. People already know their immune status. They are getting a little bit bored. So we now really had to think how we could, what we could change, how we could recruit new patients on one hand, and also make it more attractive for current participants. So what we now do, every new employee of the hospital at his first day coming to the hospital, he receives a link to the study where he can find the information and registrate. This is, by the way, our hospital in St. Gallen. Then we also now want to increase participant involvement. We ask them for feedback on study topics, how they want study results to be communicated, and we also plan to include participants in our scientific board. And we also want to extend the scope of the study. Healthcare workers are like in the interface between the general population and the hospitals. And so there are lots of opportunities to also study other infectious diseases than COVID. And that's what we are doing now at the moment. We are looking at antibiotic resistance. We are doing a cross-sectional study. And among other things, we are also doing rectal swab. So we ask people to send us a rectal swab, and we look for colonization with resistant pathogens. And we have also now a One Health aspect. We ask people to send us also poop from their pets, so we can see if they maybe have the same resistant pathogens as their pets at home. So yeah, this is it, the surprise study from Switzerland, healthcare worker cohort. We try to focus a little bit more on other things than COVID for the future. And the challenge is really to keep the participants in the study. We have a large team. I would like to say thank you to all of them, although no one is here. And I would like to thank you for your attention.